Hello, everybody. Welcome to section 6 of our virtual mini conference. We're going to give it a couple more minutes just for people to kind of get back in and get that cup of coffee between sessions, and we'll get started in just a couple minutes. Also, feel free to jump into the chat pod and tell us where you're from. We'd love to see where everybody is. Thank you, Clarissa, for being first one in the pool. Give it about one more minute to let everybody get into the room. And about 30 more seconds, and then we'll go. Okay, I think we have our group. Welcome back, everybody. Thank you for coming back for session 6 of our virtual mini conference on the safe system approach in rural areas. I'm Kevin Elliott. I'm the marketing manager for the National Center for Rural Road Safety, and I'll be your host and sort of facilitator for this session on post-crash care in the rural context. A great topic, a hot topic, a very relevant topic, and we have some amazing presenters for you to hear from and learn from and ask questions of. So let's get into it. Some logistics up front. It's going to be about an hour and a half this session. This is our last session of the day. So please hang with us because we'll have any wrap-up questions there at the very end. To activate closed captioning, if you need that, you can just hover over the bottom of your screen there and you should see that icon, the CC icon, toggle it on and off as you need it. We're also recording this webinar for our website archive. That little QR on the bottom right over there will take you to our webinar archive, and we have a bunch of them there. So if you missed a session earlier today, or if you missed any of the other ones we've really ever done, go there and you can find them. It's a great archive and a resource. The Q&A pod is where we're going to ask questions if possible. You'll notice there is a chat pod where you all are putting your location, and then there's a Q&A pod where you can ask questions of our presenters or anybody from the center. You can ask for favorite roast beef recipes if you want to in there. That's what the Q&A pod is for. Now, if you cannot, we had some feedback from folks earlier that they couldn't see the QA pod if they were on their phone, and understood. That's totally fine. Ask your question wherever you can, but if you can, please use the Q&A pod. It just makes it simpler for us to monitor and vet those questions. Handouts are also available, so you don't have to take pictures of your screen throughout these presentations. We can get these presentations to you later on. They'll be available for download if you want to collect these slide decks. And also, please complete the feedback form we're going to give you at the end of the webinar. We really do read those. We really do take them to heart, and we really do adjust our operations and our content based on your feedback. So that is not just busy work. That is meaningful information we need at the center to do better and better for you. So please take a few minutes and do that at the end of this. If you need certificates of completion or CEUs, they will be provided after the fact. So those are some logistics. Also, some announcements, some advertising. What kind of marketing manager would I be if I didn't take this moment to advertise a little bit? We have a podcast at the center called Home Safely, and we talk to rural safety transportation professionals around the country, and we are loving this thing. It's a great resource for you to hear from people around the country who are in the trenches like you are every day. Our latest episode is out with Holly Kostreski. She is amazing. If you know Holly Kay, she was with federal agencies for 20 years. She's from a frontier rural area in Minnesota. She's a wonderful personality and an expert in transportation safety. So we interviewed Holly on this latest episode, but we have 8 others before her, and we have several others in the queue. So stay tuned and subscribe to that. You can subscribe on any of your major podcast platforms. So tune into that one when you can. Also, Rural Road Safety Awareness Week, which was one of our favorite things we do at the center, is coming up the 3rd week of July. Every year, if you follow along and you know Rural Road Safety Awareness Week, we pick a big theme and we have fun with it. This year's theme is video game theme, and the topic is the rural modes. All of you are out there in rural areas, and you know the diversity of transportation modes in rural areas is unparalleled. You can have all of the different modes on one little road in the middle of a cornfield somewhere, and that presents safety challenges. So we're going to talk about that during Rural Road Safety Awareness Week, July 13th through 17th. Follow along. Go to our website. There's a QR code right there. We'll give you free stuff you can share in your social media and download and take to meetings and use as you will. So that more on that forthcoming, but it's coming. FHWA has an upcoming webinar we want to tell you about on May 7th. That's next week, next Thursday. FHWA Rural Road Safety Webinar Series. This one is on innovative funding processes for rural road safety. We know it's hard to do anything without money, and so we want you to have access to the latest information on how to handle innovative funding and those processes in your areas. Speaking of money, the Safe Streets and Roads for All program, the NOFO, is now open. Deadline is May 26th. You have just under a month to get your applications in. This program has granted lots and lots, billions of dollars over the last few years that goes to local agencies like yours. So we really recommend you try and take advantage of that. The link to the NOFO is right there, and you can go learn more about Safe Streets and Roads for All if you haven't heard about it before. So trying to bring these funding opportunities to you. And we have there is a cool program. This is not our program. This is FHWA's, but it's called Build a Better Mousetrap. We know that, as Jay Otto always says, the answers are in the community. So if you look around, there is probably somebody in your maintenance shop who has figured out a new thing to put on the snowplow that does this one thing a little bit better. We want to hear about that stuff, because those answers are out there in the community, and the Build a Better Mousetrap program is there to help, 1, collect those great ideas from out there in the field, and then 2, to celebrate them and to promote them around the country. And they give out an award for it. So please, if you are a part of a local public agency and you've seen one of those really cool things, encourage those people to apply for Build a Better Mousetrap. To apply, contact your local LTAP or your regional TTAP, and they can get you plugged in. Nominations are due June 7th. Okay. I told you we have stellar speakers for you on this session, and here they are. Dia Gainor is the executive director of Dia. I'm going to have you explain that exceedingly long acronym. I've frankly have forgotten it. I'm not going to try and say NASMISO or some silly thing like that. But Dia Gainor is an amazing person and presenter, and she's going to go first. Grady Carrick is with Enforcement Engineering, and he's going to talk to you from his experience, decades as a Florida State Trooper, and in his current work that he does in post-crash care. And then Anna Piper, who's a program manager from Franklin County Safe Roads and Columbus Public Health. But first, let me introduce Dia Gainor and actually get her get her name right of her organization. Dia is the executive director of the National Association of State Emergency Medical Services Officials. Dia Gainor's fervor about roadway safety took root in 1980 as a volunteer firefighter specializing in vehicle extrication in Southeast Pennsylvania. Serving simultaneously as a paramedic with a separate ambulance service, her 911 response area included both dense corridor clusters as well as suburban areas. After moving to Maryland, she began working for the state coordinating medevac helicopter response statewide, and then as a regulator with responsibility for implementation of the first paramedic certificate program. She served for 19 years as the Idaho State EMS Director, where the true implications of rural road perils and preventable deaths were endemic. As the Executive Director of the National Association of State Emergency Medical Services Officials for the last 15 years, Dia has fulfilled multiple national roles and is the recipient of several prominent awards in recognition for her work in EMS. I told you she was impressive, and I'm going to turn it over here now to Dia. Dia, please take it away.
Thank you, Kevin. And I trust everyone can hear me and see my slides.
We can and we do.
Amen. Well, our acronym is pronounced NASEMSO, like I said so. I'm really looking forward to sharing some insights about post-crash care with everyone today. And I'll get right underway. There's no credit on this photograph because I took it. This is about an hour north of where I live in Boise, Idaho. This is a county road. And ignore the bullet holes. But the point is, this may feel like uncharted territory to you. It's emergency medical services, 911 related issues, helicopters, trauma centers may not be the typical thing you focus on in your daily work, but I'm delighted to be here and share some insights and ideas with you. The big bottom line, this is courtesy of NHTSA, is the fact that not all fatalities are dead at the scene. That 43% estimate that's based on an analysis of FARS data suggests that there's a big population of fatalities who could be saved with optimal 911 incident detection, EMS, and trauma care. I thought it was really important to share this resource with you because NHTSA was kind enough to drill in by state to look at what that percent is on a per state basis. You can go to either the URL that's across the bottom of the screen or use the QR code to see this graphic in more detail. But it varies wildly. Obviously, the darker the color, the higher the percent of individuals who are still alive at the scene. But to put things in context, given that all I've done is work in and for state EMS offices as employment goes since 1984, I find that our transportation and highway safety and rural-focused individuals may not understand what your state EMS office does. They are first and foremost a regulatory agency, licensing paramedics, EMTs, ground ambulances that respond to 911 calls, helicopters. They also designate which hospitals or trauma centers to set minimum standards for those facilities and assure that they're prepared to care for severely injured persons. But they're also engineers of systems of care, looking for innovative ideas, raising the quality of patient care overall. And very importantly, they manage a massive patient care record submission system, not unlike the crash reports with which I'm sure you're already very familiar. In fact, last calendar year alone, the states uploaded 64 million ambulance response records into this system. And I want to encourage you to find your state EMS office because the National EMS Information System data is very robust, very available in a variety of graphical forms. There is not one universal standard of how the data are displayed, but I would really encourage you to reach out to your state EMS data manager. If you can't find them, I can. So please don't hesitate to reach out to ask about contact information. This data, when retrieved at the state level, can be broken down by county, by zip code, by census tract. There's a tremendous amount of information and insights into both fatal and non-fatal victims of roadway incidents. What's really important is the fact that nearly 90% of those data are available within about 3 days of the incident occurring. So the timeliness of the data is astounding. At nemesis.org, NHTSA has also enabled views on a NHTSA regional basis, and I'm just pointing out to you some examples across the bottom. The EMT or paramedic who cared for the patient captures injury risk factors. These are set by the American College of Surgeons Committee on Trauma, as well as the EMT or paramedic's assessment of drug or alcohol use. And that may provide additional insights. I will say from my 12 years in the field in the back of an ambulance, it's a confessional. And especially if there's no law enforcement officer present, the very revealing information may be captured by the EMS personnel in contrast to law enforcement. So how does this whole system work? Can't be that complicated. First, find the roadway incident location, detect that it even happened in the first place, a pressing problem in rural areas, take care of the victim, and get them to the right hospital. How much more is there to it? Well, there's a great deal to it. First of all, the 911 center, which depending on the size of your jurisdiction, you may have one 911 center, you may have 100 911 centers. A good question to ask is not only what their data shows about roadway-related incidents, but very importantly to ask whether or not they use emergency medical dispatch, which is standardized protocols for how to speak to the caller and instruct the caller how to care for themselves before the ambulance arrives, or care for their fellow passenger, or they're a bystander. We call that dispatch life support. So I have a list of questions towards the end of the presentation, and that's one of them. There are 5,400 911 centers in the United States. So, the other question to ask about your 911 center or centers is whether or not they are receiving electronic AACN notifications. And if so, how the 911 center is relaying the very rich information in there, including injury severity prediction scores. In rural scenarios where the ambulance could easily be 26, 36, 46 minutes away from that incident scene, having the earliest possible injury severity prediction makes a big difference. And also how sophisticated is their GIS system. So I mentioned the call-taking protocols or emergency medical dispatch protocols. They're extremely important in facilitating bystander care, family members caring for each other, co-workers taking care of each other, and other scenarios. You're likely, if you delve into the post-crash care space, or maybe have a family member who's an EMT or paramedic, you're likely to have heard about pre-hospital blood transfusion being one of the hottest topics in the post-crash care space right now. Unfortunately, this is only being done by about 370 ambulance services in the United States, when there are 11,500 ambulance services in total. So given the vast research that's in place already since many preventable deaths, that is, individuals who weren't killed instantly. The percent of patients that might survive as a result of earlier blood transfusion than waiting until they get to the hospital is significant. And of course, rapid extrication. There are now varying schools of thought about practices related to extrication. That's another opportunity for exploration. So I did want to share this slide as well. Not sure, I hope it is displaying properly. All of the red, white, and blue graphics in this presentation are courtesy of NHTSA. So the time is critical, but the bottom line on this slide, for every minute of delay, that a patient who is effectively bleeding to death, and that doesn't mean bleeding out, onto the asphalt. They could have internal bleeding in their belly, in their chest. For every minute of delay of administering blood, the risk of death increases by 11%. So there's a great deal of activity going on in initiating pre-hospital blood transfusion in the United States. Rural presents very unique challenges related to accomplishing that. And again, this may be an important topic to ask about. So these dark blue counties are those where, according to the latest assessment that was done by the Pre-Hospital Blood Transfusion Coalition in 2024, it might sound like it's dated, but we're up to about 375 or so AMILT services providing this critical intervention. So the point about getting to the right hospital just happened to be here in Kansas City, Missouri today. And here is their graphic, their map of the state. The orange starbursts are the locations where the drive to a level 1, 2, or 3 trauma center is 30 minutes or less. That means every area not in an orange starburst is more than 30 minutes away from a level 1, 2, or 3 trauma center. Another, good depiction here in Montana. While Billings did just get a level 1, all of the other dots that you see in this vast rural state are levels 2, 3, or 4. And this is significant because the capabilities of the hospital increase as the number gets smaller. So a level 1 or 2 trauma center is associated with patient survival that's 25% higher than other hospitals. So where the patient gets taken is essential. We're advocating for highway safety planning that actively includes post-crash care. And certainly hope that's an outcome of this webinar today for you in your daily work. The importance of traffic incident management education to include an appropriate representation from the EMS community, not just the fire community. Ambulance services may or may not be fire department based, and law enforcement, but also to make sure that 911 personnel and EMS are included. The staffing crisis in 911 centers cannot be ignored. It is most graphic in rural areas. And then ultimately utilizing the Nemesis data for identification of improvement opportunities. So simply put, and this was a proof image from a proof of concept that our association, NSEMSO, did for NHTSA, to illustrate that we believe there is a method of quantifying rural roadways in terms of how few ground ambulances are in proximity to that location, how many helicopters could get to that location in 30 minutes, 60 minutes, 90 minutes, plus distances to any hospital, let alone level 1 or 2 trauma centers or uniquely qualified centers such as pediatric trauma centers and burn centers. So I promised you a list of questions to take back home. I'm not going to roll through all of these. Hopefully, I've touched on every aspect that's on this list. If you would like to talk about any of them more before finding your EMS counterparts in your jurisdiction, I'd be delighted to do that. Also, NHTSA has, as I mentioned earlier, invested in some great infographics, not all of which I went over in great detail today, but those are very handy as conversation starters as well. And with that, I'll pause, see if there are any questions.
Thank you so much, Dia. Thanks for the very comprehensive in such a short amount of time presentation. There is one question regarding NMSIS data. So somebody asked a question. They're from an MPO, and they're having a hard time getting access to NMSIS because they weren't classified as a public health agency. Maybe. Do you have any strategies for helping them get that data?
Well, certainly. The key to answering that question is to frame your request as aggregated and de-identified data. Usually, when a public health phrase is used as a reason to say no, it is the perception of the request is that you're seeking incident-specific data. And that's really where the quandary comes in, because these are, in fact, medical records. However, most state EMS data managers are pretty savvy at guiding the process of asking what it is you need and how. And again, I'd be happy to make sure you're connected directly to the EMS data manager in your state EMS office and maybe take another run at it.
Okay, great. Thank you. Another question, does giving blood have to do with credentialing? Why only about 13% of the EMT centers giving blood instead of all of them? If that makes sense. I read that question.
Yes.
And Dawn, does that make sense to you? Okay.
It does. It does make
Okay.
sense. Okay, so first and foremost, it can be a scope of practice limitation. If a rural ambulance service has emergency medical technicians or advanced emergency medical technicians, blood transfusion has never been considered as legal, if you will, as far as their clinical skills are concerned. Today, as of today, it is limited to paramedics only. So unless your rural jurisdiction has one or more paramedics, it is highly unlikely that blood transfusions will be available via that ambulance service.
Got it. Thank you. And one more question, and then we'll move to Grady. Have any DOTs implemented or are planning to use drones for blood transfer for transfusions in rural or even urban crash sites?
Oh, I owe somebody $20 for a great question. Not yet. However, the US DOT Volpe Center is investing heavily in what's now in a phase 2 demonstration project to do just that. And very rural locations, in fact, one out of Eastern Oregon is being contemplated, that would, in effect, cover very rural parts of 3 states. There's also work occurring in Alaska along the same lines. And that's referred to if you were to search, I'm not sure what you could locate via the Volpe Center, but I'm happy to drop a website into the chat of the organization that's doing that research.
Very cool. Thank you so much, Dia. And thank you, everybody, for being engaged in your great questions. Let's move on to Grady Carrick from Enforcement Engineering. Grady is a retired Florida Highway Patrol chief who distinguished himself as a champion for traffic operations and safety during his 30 years with the agency. Since his retirement in 2012, Grady has worked with local, state, and federal agencies to advance a safe and efficient transportation system in a consulting role. He is passionate about traffic and responder safety, and he has a national reputation as an advocate for traffic incident management. His work as a researcher has produced more than 50 peer-reviewed research publications, many in the TIM domain. Grady, welcome to our mini conference and take it away.
All right. Are you able to see my screen and hear me?
Yep, you sound great, look great.
All right. Thank you, Kevin. Thank you for that introduction as well. And thank you all for being here at this session. So I want to spend a little bit of time today talking about traffic incident management and really putting it in that context of the rural setting, particularly in the rural roadway incident or crash. And really, I think a good place to start would be just to kind of remind everybody of what a traffic incident management is. And it is this planned and coordinated multidisciplinary process to detect, respond to, and clear traffic incidents so that traffic flow can be restored as safely and quickly as possible. And there's a lot more that goes along with that. Working with some sense of urgency to clear the roadway and clear the scene that we'll get into a little bit during our presentation. But really, TIM involves everyone that would be at the scene of a traffic incident. Law enforcement, towing, fire, EMS, and transportation agencies, and certainly others. And then, as Dia mentioned, also the dispatch personnel and others that might be operating remotely to support those functions and ensure their success at the scene of a roadway incident. So for some of you who may be familiar with traffic incident management, one of the things that we always like to point out is traffic incident management is not just for urban rush hour freeways. It's for anywhere that incidents can happen and anywhere responders are tasked with going to respond to incidents. They can be on these roads with limited sight distance due to hills and curves, gravel and unpaved roads, and roads with markings and other features that might not be completely up to standards. So just a little reminder here that TIM applies everywhere, and that's kind of why we're going into it here in today's presentation. So here are some statistics from the Bureau of Transportation Statistics, and as highlighted here, rural roads really account for a significant portion of the total lane miles in our country, and they really play a significant role in the transportation system and moving people and goods. And it also reinforces that this is where incidents occur in many cases, and again, reinforces our need to manage these incidents in a way that's effective and promotes safety. When traffic incidents occur in rural settings, they often are quite unique and they're different from urban and suburban roadway locations. And the roadways themselves may be narrower or unpaved or have little or no shoulder. And then they also, as pointed out, may have hills and curves and other features that limit or impair sight distances. Oftentimes we see higher speeds and lighter traffic, and that's always a bad combination. And whenever there's any kind of weather, it can really make these things more pronounced. We'll also mention a little bit later these unusual road users that we sometimes encounter, like slow moving vehicles and farm equipment and other other road users. So for our responders, not only are these locations unique, but our responders have some unique challenges as well. And many times there may be only one or two law enforcement officers for large geographic areas. 2- and 3-person fire crews are not unusual, and volunteers often make up a significant part of the fire department response. And then if we try and do any kind of traffic management or diversion, sometimes it can require very long distances and detours. So long distances in themselves are part of our challenge. It takes time to get to these incidents because they are in these rural and remote locations, and that in itself can be complicating. So again, Dia really set the stage for us. When we talk about post-crash care, we want to focus on the objectives as it relates to the National Roadway Safety Strategy and the Safe System approach. And it really it gets to the heart of these three things: the access to emergency medical care, creating a safe working environment for the responders who are there on the scene, and then preventing secondary crashes. Oftentimes talk in traffic incident management courses about exposure and how our incident responders and victims at these incident scenes are exposed to these secondary crashes. And then the secondary crashes can also involve innocent people that are approaching and trying to navigate around our roadway incidents. So if we look at the objectives of traffic incident management as it relates to post-crash care, the outer ring of this circle kind of describes the processes that are involved, where we're focusing on training responders and others to be more effective at the scene and to operate operate safely at the scene, getting that responder there, getting the medical care there to the scene and en route, and then once we're on the scene, operating with that sense of urgency, trying to create that safe working environment by creating traffic control and blocking and providing an envelope of safety there on the scene, and then warning motorists that are approaching that, hey, there's something up ahead that we need to be aware of. And then finally, we're going to get that patient off the scene and to a appropriate level of trauma center as quickly as possible. So again, that's kind of a graphic that describes this TIM process as it relates to post-crash care. And it really all starts with training. The National TIM Responder Training is a program that has been in effect now for about 12 or 14 years, and it's been endorsed by all of the responder groups representing police, fire, EMS, transportation, towing, and others. So all the national organizations have said this is the way we want it done. And over the last more than a decade, 850,000 boots on the ground have been trained. Most of them have gone to a 4-hour classroom training. And but there is also this online training that's hosted by the National Highway Institute. So like many things in our world, it starts with training, and training responders and others in this national training is foundational to traffic incident management. Now, getting to the scene really implies a lot in terms of response activities. One of the ones we highlight is emergency vehicle preemption. We realize that in rural and remote areas, there may not be a lot of signals that slow down response activities. But I always tell folks that congestion is relative, and just one or two signals that a responder has to stop at can delay them, and those seconds are valuable, and sometimes they translate into minutes. So this technology gives them a green wave. It gives them green traffic signals as they're approaching, and this technology has been around for quite some time. And it can be either hardware based, where the emergency vehicle communicates with the signal and the signal turns green, or it can be a cloud-based solution, which is more common now and more economical. And that's where the vehicle locator that's in the emergency response vehicle and the traffic signal system, which may be controlled remotely, are able to communicate and give them that green wave. Interestingly enough, I had an opportunity to work with the Seminole County, Florida fire and rescue department, where they implemented this cloud-based solution. And Seminole County, to give you some context, is pretty much between Orlando and Daytona, and it's largely suburban and rural in nature. And this really, this implementing this emergency vehicle preemption has really helped them tremendously in uh, improving their response times. So getting to the scene is the next critical part. And then once we're on the scene, it's that everybody pitching in and doing their part. Um, and again, we're involved with protecting the responders. The foundation of our safety at the scene is we're providing a protective block with emergency vehicles, and then we're trying to set up some traffic control, manage traffic, and again, we're trying to warn folks that there is something up ahead that they need to be aware of so that they can plan accordingly and slow down and move over and all the other things we want them to do. So working together is really what it's all about. Every responder that's on the scene, whether they're the first ones there or they're there working with other responders, is responsible for managing traffic. And a lot of places around the country, they've taken this responsibility on, and they've created specialized response activities and units that are equipped to handle traffic, and they can roll out, and they have all of the traffic control devices, and they have the training to direct and manage traffic and set up detours and other things. So here's some photographs of some teams that are in different places, and these are very effective in rural settings. As a matter of fact, in the mid-Atlantic states, in many of the rural communities in Maryland and Pennsylvania, they have fire police, which are folks that are attached to volunteer fire departments, and they can go out with this specially equipped vehicle, and they can really just take ownership of the traffic control and allow the other responders to do the other responsibilities that might be required on the scene. Certainly when we're in rural and remote settings, we're often dealing with two-lane roadways, and when there is a traffic incident, a lot of times that will require the use of alternating traffic. And so the use of flaggers is another thing in traffic incident management that we speak about and we train to, and teach the flaggers where they should stand and how they should communicate with each other so that they can alternate traffic in either direction, to safely get them through a one lane diversion essentially. Advanced warning is another thing that's really so important, particularly again in rural and remote settings where you get higher vehicle speeds, you get some of these visual obstructions that we talked about, and certainly lighter traffic where someone, and we've all kind of been there, right? You top a hill or you round a curve and there's something unexpected there. So providing some warning in advance is another very important part of traffic incident management. You all have some kind of weather phenomena where you're at and where you live, and that's really something our rural responders deal with. They know what is unique to their locations, and most of the time they have come up with some measures that they will implement when the roads are affected by these weather phenomena. We talk about the uniqueness of rural and remote settings, and agriculture, animal transport, and other unique incidents are certainly a potential part of that. We worked actually with the National Center for Rural Roadway Safety a couple years ago in looking at rural TIM, and we had some folks from Iowa and Nebraska on that helped us understand these animal transport incidents, and it was quite interesting, to see and hear about when incidents happen, how they have a specialized response in many cases. Now, in addition to those agricultural products, a lot of times there will be, fertilizers and chemicals and other things that are used in agriculture. And sometimes the vehicles may be pretty apparent. The dangers may be pretty apparent, but a lot of times, the quantities that are involved, they may not be placarded or readily apparent, maybe in the bed of a pickup truck, for example. So our responders have to be keenly aware of the dangers and potential dangers involved with that. So earlier in our presentation, we talked about the challenges that our responders face, and here's just kind of a recap of those challenges and some of the actions that responders might take to to mitigate some of those things. The two out there to the right are two of the big ones in my view. The longer response distances is a big one, and then privately owned vehicles and volunteer fire folks responding. That in itself can create some challenges and sometimes some hazards. So again, some good training and good policy as it relates to those things is an important part of it. Another thing that we found out doing the Rural TIM project with the Center for Rural Road Safety is, realizing that some places their situations are so unique that they actually have to have specialized approaches and specialized plans for the animal transport that we mentioned. But we also talked to some folks that have the horse-drawn carriages and wagons and other types of road users that are quite common, but quite unique to certain areas. So again, those response challenges are best addressed as needed. So to kind of sum things up, a robust traffic incident management program really supports post-crash care. It's going to hopefully expedite access to the medical care, create that safe working environment, and prevent secondary crashes. And Kevin, that's the end of my presentation.
Thank you so much, Grady. That was great. We actually got a couple of questions in here for you, so we'll jump right into them. The first one is, what kind of training is provided to first responders in dealing with hostile or angry motorists resulting from them being rerouted?
Yeah, that is a tremendous challenge, and I know folks, folks know their area, and a lot of times they know how to navigate around these incidents when there's a road blockage. But sometimes folks are just passing through, and when you're telling them you have to get off this road, that just takes them completely out of their comfort zone. So law enforcement will probably be the ones interacting with people at these road closures. And in most cases, they're able to hopefully provide them with the guidance that gets them back on track. Sometimes folks will just say, hey, I'm just going to sit here and wait it out, even though it might be several hours. And if that's their comfort zone, then again, law enforcement can make accommodations for them to park their vehicle in a safe place and just wait the incident out. Good question, though.
And Dia actually had a question. Is our rural ambulance service protected by EVP when they get to the city where they're transporting to a level 1 or level 2 trauma center?
That is a great question, Dia. In the locations where there is signal preemption, there would have to be a coordination between the ambulance provider and the transportation agency that is managing the signals. So if that's something that is quite frequent, that is probably a conversation that a remote or outlying ambulance company would want to have with a suburban or urban signal system.
Okay. Okay, those were all the questions that came in there. So we will transition over to Anna Piper, our last presenter of the day. Anna Piper is a program manager for Franklin County Safe Roads in the Columbus Public Health. She's a public health practitioner specializing in traffic safety and injury prevention. Her work focuses on applying the safe system approach to better understand, analyze, and prevent fatal and serious injury crashes through a systems based, data informed lens. She has experience facilitating multidisciplinary fatal crash reviews, working with partners across sectors to identify systemic contributors to crashes and translate findings into actionable prevention strategies. Anna has presented on fatal crash review processes at state and national conferences, and her work has been featured at the Transportation Research Board annual meeting. In 2025, Anna was recognized for her work in preventing traffic fatalities on Ohio's roadways by being the inaugural recipient of the Ohio Traffic Safety Leadership Award by the Ohio Traffic Safety Office. Without further ado, Anna Piper.
Well, thank you. Can you hear me okay?
We can.
Okay.
Can't see your slide deck yet, but we hear you fine.
Perfect. Alrighty. Bear with me. I'm kind of working with my single screen today. Here we go. Okay. Can you guys see my slides?
We can. You're good to go.
Love it. All right. Well, good afternoon, everyone. I am really happy to be here, and I'm super excited to talk to y'all about traffic fatality reviews. I want to make sure that I get through everything, so I'm just gonna jump right on in. And to start, I just want to briefly ground us in the context of Franklin County, where my work is taking place. So Franklin County is home to over 1.3 million residents, and it includes Columbus, which is the state's capital and the largest city in Ohio. It's also one of the fastest growing regions in the Midwest, with Columbus now ranking as our 15th largest city in the country. So while this is a predominantly urban area, it does function as a regional hub, and it includes suburban and rural fringe environments as well. From a transportation standpoint, Franklin County has over 4,000 miles of roadway with a mix of urban streets, suburban arteries, and some rural roadways. Between lower speed local roads and our higher, the county does see over 10 outbound travel. That level of inflow, combined with Ohio being very wide and flat, our roadways, it contributes to higher speeds, specifically on our arterial corridors, which do function similarly to rural highways in terms of speed and severity risk. The system serves a very diverse mix of users. We have drivers, pedestrians, cyclists, and transit riders, but it does remain heavily car dependent, with about 80% of our commuters driving alone. In terms of vehicles, I like to always point out that we have our county sits at an intersection of major freight routes, I-70 and 71. So there's a strong presence of commercial traffic. We also see a lot of that commercial traffic extending into our rural parts of the county, with several major distribution hubs in the rural communities. Finally, Franklin County benefits from having very strong EMS and trauma care access. However, response times can be impacted by traffic congestion as well as distance, especially in our rural fringe environments. As you all know, in any setting, survival often just comes down to how quickly and effectively that response is going to happen. So while the context of where I may work may differ, I want to emphasize that the core safe system principles remain the same. We have to design a system where human mistakes aren't resulting in fatal and serious injury outcomes. And no matter where you are, I believe that you can implement a very robust fatal crash review program. So with that, just some quick context on how the Franklin County Traffic Fatality Review came to be. I kind of have to talk about our grant funding. So Ohio Safe Communities is a federally funded project from NHTSA, which is provided to grantees through the Ohio Traffic Safety Office. About half of about half of the 88 counties in the state have a Safe Communities program. While each county has the ability to identify and define their own goals, we're all grounded with 5 shared primary goals, which are increasing our seatbelt usage and impaired driving awareness, increasing motorcycle safety awareness, coalition building, and last but not least, the fatal data review, or as we refer to it, traffic fatality review. Franklin County Safe Communities has been facilitating traffic fatality reviews for about 2 decades. Over the years, the goals of these meetings has changed, as well as our strategies and priorities. Our Fatality Review Board convenes monthly for just about 2 hours to discuss fatal crashes that occurred in the community. The purpose of the meeting aligns with what we are required to do per our grant funding requirements, which is to review every fatal crash that occurred in the county. That is no small feat because our county's 5-year fatal crash average comes out to being about 106 fatal crashes per year. Our program has 3 primary goals for our meeting, which is to review every crash within about 12 months of occurrence, develop recommendations from each crash that work towards minimizing crash severity and preventing future crashes from having fatal or serious injury outcomes. And our long-term goal is to work ourselves out of our job. So traffic fatality review meetings have primary members who need to be at every single meeting and members who are just as important, but whose absence wouldn't create an impediment to the meeting overall. During the meeting, the following individuals are all present crucial information to the totality of understanding the crash. Those people are the Fatality Review Board coordinator, a law enforcement representative from the agency responsible for the investigation for the fatal crash that's being reviewed, state, county, and city transportation engineers, an EMS representative, and a representative from our county coroner's office. All of our other review board members, like I said, they're equally as important because they all have a professional or educational background that makes them equipped to weigh in on preventing future tragedies. I listed a small sample of some of the other agencies and individuals that are sitting on our review board. I'm not going to go over all of them, but some notable ones are injury prevention coordinators from each of our local trauma hospitals, a representative from the prosecution side of our city attorney's office, our regional transit authority, our regional planning commission, and alcohol and drug program specialists. Alrighty. So now we're going to get into kind of the meat and potatoes of things. So each crash is important, even if on the surface it feels similar to dozens of other crashes that have happened, which is why we review the same set of information from each incident to get a full scope of what happened during our crashes and to really understand what factors were present to allow a fatal crash to even happen in the first place. Here's kind of a breakdown of the content that's reviewed during our meetings and the flow that we present that information in. So crash reports and investigative details are presented by the crash investigator from the jurisdiction that the crash came out of. They're going to provide an overview of the crash narrative on the crash report, as well as any details that were uncovered during their investigation, such as EDR data, witness statements, if SFSTs or standard field sobriety tests were performed, and so on. As that law enforcement representative is reviewing their information, the meeting coordinator is also presenting photos and videos that were collected by law enforcement on scene. Those photos will help with understanding the severity of the crash and to assess behavioral factors like belt use, distraction, or impairment. Next, driving records and citation history is going to be collected and presented by the meeting coordinator from the state's BMV database. Driving history from every person who is behind the wheel during the crash is shared because their history may reveal patterns and unsafe driving behaviors that might be related to the crash. Then aerial maps and location context is presented by a representative of our engineering office that's responsible, for the maintenance of the road and corridor where the crash took place. Location context includes stuff like if the road was wet or dry, if it was straight, or if the crash took place on a curve, what the speed limit is, and then the historical fatal and serious crash data of the corridor. This information is used to just kind of generally get an assessment of what the safety is on that roadway. The transportation engineer will then go into their assessment of the roadway. So when they went out and looked at the road after the crash took place, they're going to talk about what they saw for lighting conditions, pavement markings, signal timing, sight distance, and really anything else they observed. They're also going to share any details for upcoming improvement projects that they have planned for the area or the status of improvement projects that are currently underway. Next, an EMS representative will share information on their post-crash care efforts. So That'll include information like how much time it took for them to get to the scene after they were dispatched out, how long they were on scene for, how long it took for them to go from the scene to the ED that they took the patient to, and any other important information for understanding the crash and the crash's severity. So resuscitative efforts, witness statements if they collected any, sometimes things that might be missing on a crash report that EMS would know. So if a patient was wearing a helmet when they got into the crash, things like that, that we might not know from the crash report itself. Finally, an investigator from the coroner's office is going to go over the decedent's coroner's report, autopsy, and postmortem toxicological analysis results. Once all of that information is reviewed, the review board deliberates and discusses recommendations and findings from the crash. The recommendations are based on a two-pronged question, which is what gaps existed in the system to allow a fatal crash to occur, and how can severity be minimized to prevent future fatal and serious injury crashes. The recommendations made are categorized using the 5 objectives of the safe system approach. So what we found is that the safe system approach is a paradigm shift in how we understand crashes that happen and work to prevent others from occurring. That shift in mentality takes time, so we tried to develop a quick and simple guide that just breaks down what the safe system approach is and how it can be translated into real-world applications. This guide is a tool that we provide to our review board members so that they can use it to kind of help them think about where a recommendation would fit in the safe system approach and if that recommendation is even feasible. In addition to that resource for applying the safe system approach, 1 week ahead of every meeting, I send the review board a complete agenda with some basic information that they can use to review what's going to be covered during our meeting and prepare any documentation they might need. On the agenda, I also include boxes for each safe system objective so that the review boards can use it during the meeting to take notes or write down recommendations that they're thinking of. So when we ask the question, like, how do fatal crash reviews help? I think that this graphic of the Swiss cheese model kind of really helps capture it. So no single factor causes a fatal crash. What we're looking at is a system with multiple layers of defense: our roads, our vehicles, our policies, our behaviors, and our emergency response. Ideally, in a dream world, those layers all work together to prevent serious outcomes. But when there are holes in those layers and they align, that's when tragedies get through. So this is where the safe system approach becomes really valuable. By structuring our reviews around that safe system, the safe system principles and objectives, we're able to move beyond surface level conclusions and just really assess the system as a whole. So instead of asking ourselves, well, what did the decedent do wrong? We're starting to ask questions that are like, was the road designed for human error? Were speeds survivable for the kind of crash that occurred? Were there vehicle protections that could have helped reduce injury? And did post-crash care function as effectively as it could have? And what we found is that by doing a fatal crash review, we can kind of strengthen our post-crash care response. Normally, when you're thinking post-crash care, you're thinking of it very strictly as like EMS, hospitals, trauma care, and all of those pieces are completely essential in response. But fatal crash reviews, I do think, can be implemented into your post-crash care response because they're how we honor what happened from learning from it by identifying where our system failed and making sure that those failures don't lead to the same outcome again. It's how our care extends beyond the scene of the crash and goes into preventing the next one. And that brings us, again, to how we close out each case. Before we make a recommendation, we focus and center on 2 questions. What were the gaps that existed in the system that allowed the crash to occur? And how can we minimize severity and prevent future fatal and serious injury crash outcomes? The first question, So that first question, it's going to push you upstream toward prevention. And the second one's going to keep you grounded in reality that the crashes are still going to happen, but death and serious injuries don't have to be the outcome. And when you consistently apply that lens, fatal crash reviews shift from just being a retrospective exercise to becoming really an effective tool for proactively strengthening your entire transportation system. All right, so how do we hold ourselves accountable and make sure that our recommendations have an actual impact? Twice a year, our review board will convene in person and review all of the recommendations made during the past 6 meetings. Before a biannual review, I go through the notes and recorded data from the past 6 meetings, put all of those recommendations into an organized master list. I then make Excel sheets for each safe system approach objective. Myself and my team, we go through all of those recommendations and look for themes. And by the time that we're finished, we've taken around 200 plus recommendations, and we've broken them down into 2 to 4 prevention strategies that target the most prevalent crash trends for each of the safe system objectives. I wrap up all of that work by taking those identified prevention strategies and developing them into SMART goals with corresponding objectives and actionable items to complete the project. These objectives and action items are taken directly from our master list. Because we don't want to recreate the wheel. So during the in-person meeting, review board members are split up into multidisciplinary action groups and are tasked with developing a project plan from the SMART goals they're provided. We follow up with them after the meeting and make a plan for how we're going to start getting all that work done. And outside of the infrastructure specific projects, which are assigned to teams made up of mostly engineers and planners, all of our groups that are made up of professionals from mixed backgrounds, industries, and experiences. And we assign the groups ahead of time to really make sure that people are getting out of their silos. So here's kind of the thing about our traffic fatality review. It did not become what it is overnight. The safe system approach can be really, really challenging to implement, especially if it's new to you or your partners. When I started about 5 years ago, we were using a traditional 3 E's model, engineering, enforcement, education. It wasn't wrong, but it just wasn't comprehensive and our recommendations weren't always targeted. At the same time, we were still trying to build our board up. We had about 15 members coming to each meeting, and now we're getting closer to 30. But that growth took time, it took effort, and it took really committed partners. Our process did not always look like it does today. I started adding pieces incrementally when it made sense to do it, when it was feasible to do it, and when I learned new information that made it seem like I had no other choice. And that has not stopped. Our process continues to evolve. When I go into a review, though, I like to ground myself in one principle, which is every crash reviewed is an opportunity to honor a life that was lost and prevent losing another. Because I do a lot of community outreach, and I hear from families that say that they receive very little support or sense of justice after losing someone that they love during a crash. These reviews are a really small way that we can show that their loss was not acceptable. What help? I also like to remind people that this work can take a toll. Fatality reviews, they carry a pretty high risk of vicarious trauma. But what helps is shifting from just hearing traumatic stories to creating action-oriented recommendations and turning that weight into a sense of purpose, which is why I encourage you all, if you're going to start doing this work, to focus again on 2 questions. What gaps in the system allowed this crash to occur? And how can you minimize severity next time? Because you do not need a perfect process to start doing this work. You just need a better one. And if we consistently ask these questions, we can start closing the gaps that lead to fatal and serious injury crashes. And with that, I thank you all for your time. Happy to answer any questions you have or connect offline if you have more technical questions or just want to hear some more information.
Thank you, Anna. There's some great feedback in the chat. No specific questions for you just yet, but I tell you what I will do, since we are at the end of our formal presentations, is if anyone has questions for Anna or for Dia or for Grady, we can do a little time to ask any questions that might have occurred to you after the presentations we're done. I do too. And by the way, that just personally, I love the way you framed those reviews as a way to honor people who have lost their lives. I mean, and the folks in the chat are saying the same thing. That's a lovely frame for that.
Oh, thank you. I appreciate that.
Sure thing. Well, while you're all thinking of questions, or if you have any other comments, I am going to share some. I think I'm going to share some contact information for the National Center for Rural Road Safety. You'll see our social media there. There's an info email. We do answer these emails. We will get back with you if you have any questions for us or need to follow up with anything on this or other content of ours. And there's our website. You can follow along. You can find that webinar archive. You can see Rural Road Safety Awareness Week. All the things are right there. We try to be a hub for all that information nationwide. So if there are no other questions, I'm going to ask Jamie to come back to maybe say a few final words and to thank everybody for joining us today. Thank you for everyone who was there for all three. But if you could only join one, we're glad to have you anytime. And Jamie, I will turn this back over to you.
Perfect. Thank you, Kevin. Again, I'm Jamie Sullivan. I'm the director for the National Center for Rural Road Safety. I just want to thank you all for hanging out with us today at this mini virtual conference. We hope that you learned a lot. I know I did. We will have the recordings up within the week on our website, both on the archived webinar page as well as on the landing page for this event. And we'll make sure to send out an email once those are available so you all can access them. Again, I know we mentioned at the beginning about doing a evaluation that will be sent out to you and possibly will be dropped in the chat pod as well. We would love to hear back from you about what topics you would like to hear on our next virtual mini conference. We spent the last two doing safe system approach, and so now we have the opportunity to move on to another topic. So please let us know what you would be interested in. As always, thank you for joining us for all of our events, webinars, mini conferences, our Road Safety Champion Program, and most importantly, Rural Road Safety Awareness Week, which is coming up in July. I want to thank our three speakers one more time for presenting today, Dia, Grady, and Anna, and we will see you at our next webinar. Thank you.